Now, I'm not too sure if there has been any studies yet conducted that shows quantifiably that veterans of the global war on terror have lower testosterone levels, but just anecdotally,
Yeah.
I can say that from my friends and those that I know that have gotten tested, it is definitely lower, and that's over and above the general trend in Western society that's seeing just a general drawdown and a lowering of overall testosterone levels. So, in terms of just the general population, from what you see, is that something that you're noticing too? Just generally, men are having lower total testosterone levels, and like, I guess to suss that out a little bit more, is it a factor of, or is it because men are starting to be more aware and getting tested more, so we're getting better data that's showing it's lower, or do you really think that there's an actual general decline in overall men's total
I
testosterone?
think it's both. And just to go back a second, certainly anecdotally, I see that too, that our service members, our military personnel, these are typically guys that are younger a lot of the time. If they're still in service, they're coming with symptoms. We're seeing a lot of younger men. And again, they're usually the guys that have been deployed 2 or 3 times that we
Mm-hmm.
find with a lower level all of a sudden, maybe less expectantly than we would in the general population at that age. We know that all of us start to lose testosterone typically around the age of 30 and about 2% a year beyond that. So I think you're exactly right with what you say is we are increasing screening. There are more people that are being evaluated. So the more you look for pathology, the more we're going to find it. And so, yes, we are in the place where we should be that, well, actually not where we should be yet. We should be doing better, but where more and more men are being tested and being evaluated and being treated. Still, the last statistic I saw, I think it was about 3 or 4 years ago, showed that maybe 5 to 7% of men that have been diagnosed with low testosterone in the United States are actually getting treatment for it. It's actually exceptionally low, despite the fact that
Whoa.
we think that we're giving testosterone to everybody. And so most of us would argue it's actually being undertreated and underserved. But yeah, so as far as general population, it's very likely that we're looking for more, but it's also that there are likely environmental exposures that are worsening our testicular function. So, I mean, if you look at the anatomy, how we're built, there's not an awful lot between the testicles and the outside wall to protect them. There are very few organs that are that exposed, right? And
Yeah,
so
right.
environmental factors matter. And so we extrapolate a lot of data from the fertility data, looking at the effect on cellular function, but we're all walking around with cell phones in our front pocket, centimeters away from the testicles. That's high
Good point.
frequency electromagnetic radiation. We sit around with laptops on our laps until our thighs burn. That's elevated temperatures that the testicles are supposed to live at a lower temperature than the core body.
Yeah, but I got to get this report done.
Exactly,
I
right?
got to get it
But
done.
put it on a hard
My
surface.
nuts can
That's
go. Yeah.
good to, I can find you a study pretty much on anything environmentally, and they may be incremental effects, but that cumulative effect on top of increased screening and increased awareness, I think, is why we're seeing so many more men being diagnosed.
Wow, that's stat. Only 5 to 7
That was the
percent
report
are
that
being
came out about
treated.
3 years ago, and it was a survey that was done, and it was really astounding that it's really being underserved and undertreated. Now, hopefully, every year we're doing better. I mean, there are millions of
Hmm.
men being treated every year now, but it's still, like you said, I think when we were chatting, there still tends to be a fair amount of resistance by a lot of healthcare providers to treat low testosterone or even evaluate it. So I've got patients
Hmm.
week in, week out that say I keep asking my provider to say, "Can you check my level?" Well, don't worry about it. We'll check it next time. Or they check it and it's low, and they go, "Well, we'll just check another one. We'll check another one, and we'll check another one," and they just kind of kick the can. And so
Hmm.
there has been a hesitation to treat, and we need to be more proactive in cases that are appropriate to treat. Now, not everybody on the planet needs testosterone replacement, right, or supplementation.
Right.
It's treating the appropriate patients, just like any other hormone deficiency. And again, I always kind of use my analogy as the thyroid. It's another gland in the body. It's not making a hormone. If that's the case, we treat it. And we treat it to physiologic normal levels, not super high, super therapeutic levels where there could be more risk, and we don't want them low where there's risk. We want them in that sweet spot. That's physiology.
Hmm.